Hypertension Protocol and Management. Introduction. The silent threat. High blood pressure, or hypertension, is often called the silent killer. Why? Because it usually has no symptoms, but over time, it quietly harms your body. If left untreated, it can lead to serious problems like heart attacks, strokes, kidney disease, and even death. Millions of people have high blood pressure without even knowing it. That's why it's so important to check your blood pressure regularly and learn how to manage it. The good news is, you have the power to take control. Simple lifestyle changes, regular checkups, and medication when needed can help lower your blood pressure and protect your heart. This guide is made for you. We'll explain what high blood pressure is, why it matters, and what you can do to stay healthy. And remember, you're not alone. Many people manage their blood pressure successfully, and you can too. Understanding blood pressure, how your body works. Your body needs blood to carry oxygen and nutrients to every part of you. Your heart pumps this blood through blood vessels called arteries. As blood moves through them, it pushes against the artery walls. That push is called blood pressure. When you check your blood pressure, you'll see two numbers, like 120/80. The top number is called systolic. It's the pressure when your heart beats. The bottom number is called diastolic. It's the pressure when your heart rests between beats. If blood pressure is too high, it puts extra strain on your heart, brain, kidneys, and blood vessels. And over time, this can lead to heart disease, stroke, kidney problems, and even eye damage. So, what's considered healthy? Normal, less than 120/80. Elevated, 120/129 less than 80. And high blood pressure is anything 130/80 or higher. Knowing your numbers is the emotional toll of high blood pressure. Living with high blood pressure isn't just about numbers and medication, it affects your emotions too. Many people feel overwhelmed when first diagnosed. Why? It's normal to feel overwhelmed. Being told you have a silent killer can be scary. Worries about future health and uncertainty about management are common. Lifestyle changes can feel like big, intimidating steps. Stress and blood pressure, a vicious cycle. Stress raises blood pressure, and hypertension causes more stress. This harmful cycle can be hard to break. How to cope emotionally? Talk openly with your healthcare team about your emotions. Share worries with family or friends. You are not alone. Practice stress-reducing activities like deep breathing, meditation, or gentle exercise. Celebrate small victories in managing your blood pressure. Remember, millions live successfully with hypertension. Emotional health is part of physical health. Lifestyle modifications, your first and best defense. The most powerful weapon against hypertension is a healthy daily routine. 1 key cap emoji, eat a heart-healthy diet. Prioritize fruits, vegetables, whole grains, and lean proteins. Limit salt, saturated fats, processed foods, and added sugars. 2 key cap emoji, stay active. Aim for at least 30 minutes of moderate activity, like brisk walking, most days. 3 key cap emoji, manage stress. Find relaxing activities, meditation, hobbies, nature walks, or journaling. 4 key cap emoji, limit alcohol and quit smoking. Alcohol raises blood pressure. Smoking damages blood vessels. 5 key cap emoji, get good sleep. 7 to 8 hours of quality sleep per night is essential for blood pressure control. The DASH diet, your new best friend. DASH stands for Dietary Approaches to Stop Hypertension, a proven eat what makes DASH special. Focuses on fruits, vegetables, whole grains, lean proteins. Limit salt, saturated fat, and added sugars. Rich in potassium, calcium, magnesium. Simple DASH tips. Fill half your plate with vegetables and fruits. Choose whole grains over refined. Eat low-fat or fat-free dairy. Include lean meats, fish, or beans. Cut down on salty snacks and fast foods. Flavor meals with herbs and spices instead of salt. Why it works: balances key minerals that regulate blood pressure, often lowering it in just a few weeks. Medications, what they do, why you might need them. Lifestyle changes help, but sometimes medication is necessary. Why take medicine? Relaxes blood vessels, reduces fluid in your blood, slows your heart rate. This reduces pressure in your arteries and lowers your risk of heart attack, stroke, and kidney problems. Types of blood pressure medicines. Diuretics, remove excess salt and water. ACE inhibitors, ARBs, relax blood vessels. Calcium channel blockers, reduce heart workload. Beta blockers, slow heart rate. Safe medication use. Take exactly as prescribed. Don't stop or change doses without medical advice. Report side effects to your doctor. Combine with lifestyle changes for the best outcome. Monitoring your blood pressure at home. Regular home checks give a true picture of how well your treatment's working. Why monitor at home? Detect changes early. Provides more complete data for your doctor. Reduces anxiety by giving you control. How to monitor correctly. Use a reliable device. Measure at the same times daily, morning and evening. Sit quietly for 5 minutes before measuring. Keep your arm at heart level. Take 2 readings. Fact: hypertension is called a silent killer because it often has no symptoms. Myth 3: I can stop my medicine when I feel better. Fact: medications control blood pressure long term. Stopping them suddenly can be dangerous. Myth 4: salt is the only cause of hypertension. Fact: other factors like weight, stress, inactivity, genetics, and diet also contribute. Myth 5: exercise raises blood pressure dangerously. Fact: regular exercise lower your blood pressure and stronger your health and future. Frequently asked questions. Question 1: can high blood pressure be cured? Hypertension can usually be controlled, but not completely cured. The good news is, with the right treatment and a healthy lifestyle, you can keep it well managed and protect your health. Question 2: how often should I check my blood pressure? If you have high blood pressure, it's important to check your numbers at home every day, or as often as your doctor recommends. And don't forget those regular checkups with your healthcare provider. Question 3: can stress cause high blood pressure? Yes, stress can temporarily raise your blood pressure. That's why learning to manage stress in healthy ways is so important for keeping your numbers steady. Question 4: is medication necessary for everyone with high blood pressure? Not always. Some people are able to control it with lifestyle changes alone. But for many, medicine is an important part of treatment. It's best to follow the plan your doctor creates for you. Question 5: can I drink alcohol if I have high blood pressure? You can, but in moderation. That means no more than 1 drink a day for women, and no more than 2 for men. Of course, always check with your doctor about what's right for you, resources and support. Managing high blood pressure is easier when you're armed with the right information and the right people in your corner. Where to find reliable information? Start with your healthcare provider. Don't hesitate to ask questions, and get advice that's tailored to you. Visit trusted websites like the American Heart Association, the CDC, and the World Health Organization. Many local health clinics also offer free blood pressure screenings and education sessions. Support groups. Joining a support group, whether in person or online, connects you with others who understand what you're going through. Sharing experiences and advice can be a huge boost to motivation and coping. Apps and tools. Blood pressure tracking apps can help you record your numbers and spot trends. Plus, apps with medication and appointment reminders can keep you organized and on track with your care plan. Final words: taking charge of your health. High blood pressure can feel overwhelming sometimes. But remember, you have the power to take control. Every small, healthy change you make matters. Whether it's eating better, moving more, managing stress, or taking your medications, it all adds up. Managing hypertension is a journey, not a race. Be patient with yourself. Celebrate your progress, no matter how small. And most importantly, you are not alone. Your healthcare team, Your family and your friends are here to support you. Together, you can protect your heart and enjoy a healthier, fuller life.